Hello, my name is Danielle Jimenez, and this is my week 3 video. I completed 150 questions on my exercise quizzes on Kaplan, and I have reviewed and missed all my missed questions. My top 3 questions that I'm going to go over are number 1. It's the nurse plans care for a client diagnosed with anorexia nervosa. Which goal will the nurse make a priority for the client? Number 1, gain 1/4 pound per week. Number 2, maintain potassium balance between 3.5 and 5. Number 3, eat 50% of each meal. Or number 4, identify a normal weight and height. I put gain 1/4 of a pound per week since this person is anorexic. But the correct answer is maintain a potassium balance of 3.5 to 5, which now I understand that's obviously the better answer, because with the electrolyte imbalance, we can have some dangers with the cardiac system. On here it states the client diagnosed with anorexia is at risk for fluid and electrolyte imbalance, particularly hypokalemia and subsequent decreased cardiac output and cardiac dysrhythmias, which I did know. I just figured, they're anorexic, so they need to be gaining some weight. I should have read the question better, or I guess had a better thought process of it. My second question that I wanted to go over was the nurse evaluates a client's response in a 2-week trial of ECT, which is electroconvulsive therapy, which data indicates the nurse that the treatment is successful. I honestly didn't know what ECT was, and when I take these quizzes, I don't like to research or Google things. I wanted to see what I know in my head. So I just read the answer choices and I kind of guessed. I really didn't know anything about this, or I didn't remember anything about this. The answer choices were: the client no longer experiences phobias and anxiety, the client no longer counts objects out loud, the client is no longer mute and withdrawn, and the fourth one is the client no longer displays overreaction to events. So I just read electroconvulsive therapy, so I figured it'd have to do something with, overreacting. So I put the client no longer displays overreactions, but this is a sign of a histrionic disorder, which is a personality disorder, and it's not treated with ECT. The correct answer was the client is no longer mute or withdrawn, because it's indicated that CET is indicated for severe depression or catatonic conditions after medications have failed to improve condition. So it's mostly treated, it's mostly prescribed for depression, that has been unresponsive to cognitive therapy and medication. It may be used for bipolar disorder and schizophrenia, but ECT is not used for behavioral or anxiety disorders. So I think if I would have really thought about it more, I would have kind of put 2 and 2 together, that most of these were over behavioral and anxiety, and then one was not, and I could have picked that answer. So just not even really knowing what ECT was, I could have possibly got that right. My last question that I'm going to go over, it says, the nurse provides care for a client admitted with a diagnosis of acute MI. The client's spouse tells the nurse about an anxiety disorder that the client has been self-medicating with alcohol. It is most important for the nurse to assess which symptoms. Number 1, heart palpitations, shortness of breath, and nausea. Number 2, fatigue, decreased appetite, and generalized pruritus. Number 3, tachycardia, generalized tremors, and hypertension. Or number 4, dry mouth, diaphoresis, and upper extremity tingling. I didn't really know what to put on this one. That the word alcohol kind of threw me off. But, it was mostly going over alcohol withdrawal. So you'd see diaphoresis, tremors, nausea, vomiting, all of that. I guess high blood pressure for, just going through that withdrawal. So I put number 1, heart palpitations, shortness of breath, and nausea. But it was wrong because those are all physiological symptoms related to anxiety. This is important, but not the most important. So it is correct. It's just not the most correct answer. The correct answer was tachycardia, generalized tremors, and hypertension, which I guess if the question is asking the most important would be the heart-related issues such as tachycardia, hypertension, tremors, because, alcohol withdrawal begins a few hours after reduction of alcohol intake and peaks in 24 to 48 hours. Alcohol withdrawal can be dangerous and must be managed carefully. So those are my 3 questions that I got incorrect. I think that these questions were more of what is priority, what is most correct, which, all of these answers could be correct, but it's which one's the best answer choice. So I think kind of just making sure and looking at that and focusing on, which one is most correct in a nursing standpoint, and viewing it, thinking like a nurse when reading these will help answer them better.